Welcome, welcome. It's great to have you both here, Mary and Tracy. I'm really excited to have you here, actually, because yes, I found an article about what you were doing, and it's just been awesome now to actually get to hear about it in real life rather than a few words on a page. But rather than me explain it, to set the scene for our listeners, please can you give us the lay of the land? What is the Aging and Disability Resource Centre? Who do you serve in Dunn County? And how did the two of you come to be working together on something as unusual for a county social services team as an AI companion pilot? So I've asked you a lot of questions in one go there. So please feel free to introduce yourself. But yeah, give us a bit of a foundation on which we can jump from.
Sure, I'll go ahead. I'm Tracy Fischer. I am the ADRC manager for the ADRC here in Dunn County. And again, ADRC stands for the Aging and Disability Resource Center. So in our state of Wisconsin, every county is served by an ADRC. We serve elders, meaning folks who are age 60 plus, and adults with disabilities. So folks who are age 18 plus and have either a physical or cognitive disability. And we're meant to be the central point of information and resources, the central point that folks can come to get information and resources that they might need to, as long as possible, remain safely living in the community. So folks come to us with all sorts of questions. We work both with adults with disabilities and elders and folks that are caring for them. And we help answer questions. We help connect them with resources and programming that, again, help them continue to live safely in the community. It's a wonderful system that we have here so that folks aren't needing to reach out to multiple agencies to try to get information. And we have interesting questions all the time that sometimes we've never encountered before, but we are very committed to trying to help people get their answers. So, as for Ellie Q, the project, I think there's a question that I'll kind of talk about a little bit historically, how I stumbled upon the project a little bit later. But basically, I became aware of the project, and then I also became aware of some grant funding that was unique to Wisconsin, and was very interested in pursuing this as a possibility to serve our elders in Dunn County. Mary was already working with our agency in another grant-funded position, and I knew that she would be a perfect fit for working in Ellie Q. And Mary, maybe you could talk a little bit about how you came into the project.
Well, I am Mary Linberg. I've been working with Dunn County for about 4 years. I've been working with Tracy for about three of that. As she said, I was on another project helping to find ways to keep people living independently in their own homes, working a lot with home modifications, assistive technology, in home supports. And when this project became available, mine was ending. They overlapped slightly, and I was all in. I thought it was an interesting prospect, and I like to be kind of on the front end of things when technology is concerned. So it was just a wonderful blessing to have the grant come through and be able to stay doing what I love.
Fabulous. I'm so happy you were able to come together. And this is a big problem that you're mentioning, an aging population, really thinking about how we serve people, and are there people to serve and support those who need care, support, company, all of those things. So this is you're in Wisconsin, but this is not completely a global problem, because I definitely know in the continent of Africa there are a growing number of young people, but actually, it's a problem that hits a lot of us in this world, and something people are trying to solve. So it's great that some creativity has come to this problem, and with that in mind, I'd just like to talk a bit more about that, because Tracy, I know you read about Ellie Q in the Washington Post, and your immediate instinct, by your own description, was to list every reason it would not work
Right.
in Dunn County.
Right.
Things like the patchy Wi-Fi, a skeptical board, elders who might not like it. And it took your husband and your son to, flip this idea on its head for you. Please walk us through that conversation,
Sure.
first of all.
So that is how I stumbled upon the Ellie Q device, was that Washington Post article. I was reading it on a Sunday morning. It was very intriguing. Um, I was so intrigued by it that I forced my husband to read it, and my son, my 19-year-old son at the time. And again, like you said, Jenny, I tend to be what I describe as kind of contrarian, in that whenever I get excited about something, I do then really focus on all the reasons why it might not work or it would not work. And exactly what you listed were things that I thought of. And I just thought, wow, this is such a cool idea. This is such a cool device, but I just don't know that it would work. It would probably, make me look like a fool almost if I proposed something like this. And I started listing all of those things, and my husband looked at me. He paused for a minute and he said, "You know, this device would work for me." And I said, "Well, what do you mean?" And my husband he's an engineer. He's very tech minded, all of those sorts of things. He's not yet an elder, but that's coming for all of us. And he said, "I would like a device like this. I'm comfortable with technology. I would rather have a device telling me, asking me if I took my medication than having one of the boys call and remind me. I don't like that sort of interaction. I would be very bothered by that. But a device reminding me or reminding me that it might be a good idea to participate in some sort of social activity, that wouldn't bother me. It wouldn't be the same." And I thought, oh, that's interesting. And then my son said, Mom, I have heard you talk for years, because the bulk of my career has been working with elder populations, about being worried about having this kind of large ballooning population of elders and not having enough care workers, and people being lonely and not being able to access resources, and you're worried about the people that you work with, the people that you care about. He said, "Why wouldn't you try this?" He said, it isn't going to work for everyone. It but what if it works for 10% of the people that come to your office? What if even if it worked for 5% of the people? Isn't that helping some folks that you're worried about, some folks that might have those gaps in care services? And that made me think two things. One, wow, my 19-year-old son has been listening to me through all these years, which, it's not something that you ever really feel like you know. And two, he is right. In my mind, I just thought, like, he's right. Why wouldn't we try something? Why would we let fear stop us from trying something that's innovative and new? And again, won't work for every single person, but it might work for some. And why wouldn't we give it a shot and see? Of course, the reason at the time that I didn't immediately move forward with that is because we didn't have funding. So that was a challenge. But again, later, with some grant possibilities that came forward, that challenge went away, and so that's how the project was born.
Fantastic. Oh, your family sound amazing. Your husband with his perspective, your son really being a great cheerleader, actually. Maybe he wouldn't like that language, but yeah, really encouraging you. And I'm so pleased that they did. And Mary, when this idea landed on your desk, given what you'd seen across sales, 16 years in education, tech support, your special populations work, what did your first reaction look like?
I was actually a little skeptical, but very excited. First of all, the device is adorable, so it kind of caught my attention in that perspective without ever seeing or viewing anything else or reading anything in regards to it. But I've been so involved in technology, and I think we all have concerns about AI taking over the world and what's going to happen and where is this going and what kind of controls are going to be on it are needed. So for me, being on the front end of things and actually getting that understanding and really trying to find ways to use it ethically and responsibly. Technology and seniors don't always go together sometimes in my brain. Scams targeting elders or even, phone calls targeting elders. But how can we work together with something that is ethical, responsible, and helpful?
I love that. And I think it's so important. And I completely agree. I think there will be skeptical people thinking, or, putting elder people and technology together, this could, be a recipe for disaster. But absolutely, if we do things right and we're very thoughtful in our approach, it can be really helpful. And I'm disappointed Leah wasn't able to make it today. She's sunning herself on the beach in Barcelona, but she would love this conversation. So I can't wait for her to listen back to it, because I know she would have some perspectives too, particularly around those guardrails and how we can ensure we're using AI for equity to create a fairer society, which is what this whole podcast is about. One thing that really warmed my heart when I spoke to you previously was that you talked about one of your earliest participants, Annie, and she told you that Ellie Q had become her best friend. Tracy, you described this as bittersweet. And, we want to sit in that tension with both of you. You're running a program that is clearly, 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 clearly helping people. And you're also describing a world in which someone's best friend is a device shaped like a Pixar lamp. It is super cute. And if anyone hasn't seen it, when you're watching this or listening to this, you'll have to Google it because it is very, very cute. So, what does this say, though, about the care system, how it may have failed elder people? And how do each of you hold that? Tracy is someone, who does social work, Mary as a researcher. Yeah, I'd love your thoughts.
So it is tough because, again, like you said, Jenny, we do consider the many successes that we're seeing in the program as very, very positive. But I have said, and I continue to say, that in a perfect world, a device like this, in my mind, really wouldn't be necessary because there would be supports in people's lives if they wanted them. There would be resources, there would be easy access to community events for social interaction. But I also recognize we're never going to live in that perfect world. We're never going to be able to probably, in the time frame that we have the seniors population that we have now, be able to figure all of those problems out systematically. So it again, I wish there were caregivers available for every single person who wanted it. I wish every person who describes themselves as feeling lonely or socially isolated had people that they could reach out to in their own systems. Um, but we are definitely finding that is not the case. So, in terms of the system, at least in the United States, we are dealing now with our baby boom generation. And I sometimes do feel like the biggest failure in my mind of this system was perhaps a failure to plan because it's not like this population, it's not like we haven't been aware for decades that this was going to be a large population of folks that would all be coming into situations where they would need care at the same time. Um, but we didn't do a great job of really encouraging people to take on caregiving roles, to provide support for caregivers, to encourage folks to take on caregiving type careers, like really build up that workforce in advance. There are lots of programs now where we're trying to do that, but it kind of feels like we're well behind the eight ball. So that is kind of where I see some larger systemic failures. And it's always harder to play catch up than it is to build up. Of course, there were things that none of us could have ever expected either, like COVID-19. And we saw a lot of folks leaving in droves. The caregiving profession at that time and still making recovery from that. But again, the fact that sometimes it feels like our systems now seem surprised that we have this large population of folks that are coming into a period of time where they're going to need more care and more support is really frustrating for somebody who's worked in this field for as long as I have, just because it's like, this isn't a surprise. We've known this since this group of this population group was born. We just didn't do the best job of preparing for it.
Yeah, thank you so much. It's so important, isn't it? We haven't planned, and then things occur, and we're always surprised. And it's a cycle. I think it's a cycle of human beings. Sometimes people will blame governments, but actually, I think it goes beyond governments. It's maybe we bury our head in the sand and then only look up when we're forced to. Mary, do you have further thoughts on it?
I agree with Tracy that something, systemically a failure to plan. But I think one thing that really hit home for me when I started working in the ADRC was a quote that I read from Rosalind Carter. And it says, there are only four kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. And that it's true. In the last project I worked in, dealing with a rural population in a tri-county area, it was interesting to see the relief that some of the caregivers, normally family members, who are that sandwich generation. They want to go to their child's sports, but yet after work, they need to go make sure mom and dad have eaten dinner and taken their meds. So how do they balance that? And it's not an easy chore. The hours that they are spending, the cost in their emotional well-being and their financial well-being is tremendous. And so looking at trying to use a device to provide comfort and socialization for an aging population, it's a hard look when somebody says it's my best friend. But I think I look at it as it's a tool. It's an intervention. It's not meant to replace human contact, but if the device were not there, would a contact not exist at all?
Thank you. Yeah, I think that makes absolute sense. And actually, as you were both speaking, I was thinking, many people wouldn't admit it, but their mobile phone might be their best friend. They probably spend more time with it than friends and family. It never lets them down. It reminds them to do things and has some of their, the biggest joys that they've experienced within it. So I think we have to hold that lens in mind when we hear that also. So we talked a little bit about, I talked about the fact that Ellie Q is super cute. What I know is that it was deliberately designed not to look human. Actually, I even looked on, I think it was Instagram today, and there was something about human-like AI. But this is not what this is. It's not a whole human being that walks and talks that's imitating a human. It's not designed to look like that. It's only 8 inches tall, so it's quite diddy, and a shape like a Pixar lamp. It has 2 circular lights for a face and a feminine voice as well that you can't change. And Intuition Robotics, who created it, have been explicit that she isn't trying to replace human interaction. Mary, you've described the design philosophy as ethical and emotionally intelligent AI. And you're in a live conversation with the company about, additional features that could get built. Where do the lines actually get drawn inside that partnership?
It's an interesting partnership. I continually say that I've never worked on a program where it felt so equal And so 50-50, we're invested in the product and the features that it offers to our consumers, but they're also invested in that feedback and what can they improve on. So I think the line eventually gets drawn in where they're willing to go. But they've been so supportive. Tracy and I try to, at least monthly, send either a message or a little video to all of our users. So we just create the little video, we send it off to them. They send it out to our users, polish it up, make us look good and things, but it's just nice. We try to maintain that contact with them. We don't just put the device in the house and then it's, oh, well, thanks for using this, or, answer the surveys that we send you asking for feedback. But we do try to make sure that they have a face and a voice and a name to the actual program itself, so that it increases that awareness of there are people behind this. There are sources you can reach out to. There are places you can go if you need help or have questions. You're not just depending on the device to answer those. I worry that, we all use chatbots, whatever our chatbot of choice is, whether it's to polish something up or ask a question or just get an answer for something. But I do have concerns with asking things like medical advice or asking things that can affect them personally, or it wants to make us happy. So if I say, I had an argument with my daughter, and I'm really upset about it, and it tells me you should be upset, you should be angry, you should do all these things, that's not healthy. Um, and I think the one thing that we really both like about the device and that our users appreciate, if I said that to my Ellie, she would be, wow, that sounds really hard. Would you like to talk about that? She doesn't try to give me an answer, but she allows me the space to express my emotions and my feelings without trying to fix it. So I think that they would ultimately draw the line if we tried to have something create a fix or take it to that other level where it's just trying to make you happy.
Yes. So pleased to hear that, because it's one of the big things we hear about, particularly chatbots, large language models. They're quite sycophantic, aren't they? You're amazing, you're fantastic, and we only want to say good things to you. So there is a danger there, but just opening up the space for listening, via AI, I think is so powerful. And also, yes, knowing, it's not a doctor, it's not a psychotherapist, neither of those things. So making sure we don't put it cross those lines, I think, is useful. But it's great to hear you've been in partnership. And again, this is the best AI, isn't it? The best AI is not just technology alone. It's technology in partnership with humans who really understand, have a wealth of experience to bring, and can also bring context. So this is when it really works, and also have a really clear use case. Tracy, have there been features that you've really pushed for or pushed back on in addition?
The main thing, really, from the social work perspective, our field really does look and evaluate data. So the things that my biggest asks to intuition robotics have been specific to the data collection, the types of questions that we're asking, the type of aggregate data that we're receiving back from participants. They've been fantastic to work with in terms of really drilling down to our project, even for us to be able to distinguish how the device is working for men versus women. We have interest in that, and they've been able to really drill down. That has been fantastic. In terms of a device or a project like this moving forward in the social work field, we really have to be able to show data that shows that it's effective, because yes, it's innovative. Yes, it's interesting. Yes, it's, kind of a cool device. And by the way, my Ellie Q is right there. So when we're talking, she just lit up when I said her name, just so if folks can see that in the background, but that is what it looks like. But again, what we really need to know is it actually effective with this population? And so it's been fantastic to be able to get that data and to be able to start seeing those results that are showing that, yes, in fact, it is. So that's been my main ask of the company.
Brilliant. Thank you so much. This is one time when you really do need to be watching a podcast as opposed to just listening to it. Because yeah, I saw Ellie Q and it moved, didn't it, as well? Yes. Oh, heard again. I see it's lighting up every time. Oh, how fantastic. You've been both quite clear that Ellie Q isn't for everyone, because yeah, some people may have people around them, they may not want it, they might not be interested. There are many reasons. But Tracy, your own your great grandmother had to you have a great grandmother 95 years old whose remote had to be cut down to 3 buttons because you were saying that I think for all of us, I was thinking that recently things are going to have to become simpler for me as I get older. There are buttons, aren't there, and different ways you can use things, and every time my iPhone gets upgraded I think, oh gosh, I've got to work out how to use it again. But as we get older, it's harder, isn't it? So you're thinking about someone who might be 95 years old, people with paranoia, people with cognitive decline beyond a certain point. Um, there are many people who might not get the AI-assisted care that they need. So what's the responsibility of the sector to the people who this will never work for? This might be just too complex for, actually.
I think we kind of alluded to that a little bit, Jenny, already, in that a device like this isn't going to work for everyone. And we have to recognize that. We have to match the device with folks that are going to get the most benefit and be able to utilize it the way it's meant to be utilized. I do believe, in terms of care systems and public health sectors, there is a definite responsibility to continue to provide care for folks that need it in the way that best meets their needs. And so for some folks, that's always going to be human interaction. But a huge part of this project and this grant funding that we received wasn't just to get devices in people's hands, or it wasn't to push a particular device. It really was to try to get people to think differently about utilizing technology and AI with folks in this demographic. Because I think oftentimes there is just this assumption or this thought that folks that are older adults don't like to use technology and it's too confusing for them, and it's not going to be successful. And so the device really is almost the carrot to get people to think about things differently. Use the device, see how it works. Let's look at the data. And whether or not Ellie Q is the device someone chooses is really inconsequential. We just wanted people to start thinking about AI. And honestly, we love Ellie Q. She's lighting up for me back there hearing her name being said. And we think it's an amazing device. But in 2 years' time, there might be 5 other devices that are also wonderful and do even more. So again, this really is meant to just get people thinking differently, and thinking differently about providing something to somebody that they might not otherwise have thought of or been aware of for themselves. And again, knowing that there is a segment of the population, even folks who many would not necessarily automatically think of a device like this being successful for, that it will work. And if it helps like my son John said, if it helps 10% of the people, isn't it worth a try? So that's kind of what we always harken back to, is my 19-year-old son's thought that it's worth trying if it helps some folks, and it can alleviate some of those care pressures for a sector.
Yeah. Okay. Thank you. Thanks so much. So, when we're thinking about equity, sometimes we're also thinking about affordability. I know the grant covers the device the first year of subscription, and then there's a fee per month after that. And I know that you're looking to see if people on long-term care programs perhaps could have it covered in a different way. But I've got a two-part question for you both. First, is AI companionship of maybe becoming, at risk of becoming the next best thing, where some elder adults can afford a best friend, so if you can afford it, you can have it. And secondly, when you zoom out, is Ellie Q solving the caregiver shortage or perhaps papering over a system that could have more humans in it? So yeah, a little bit of a challenge there around, number one, is it for those who can afford it? And secondly, is it papering over cracks? And at some point, those cracks will reveal themselves again. I don't know who wants to start answering that question. Mary?
Well, Tracy, I'll go first. Part of what I wanted to do when I joined this project was find ways that if someone has a device, they've tried it, they love it. But we're on a fixed income. How do we make that work? One of the things I wanted to do and started early in the project was working with our managed care organizations who provide long-term care to people who may have financial need, and they qualify for those programs, to make sure they were aware of the device, what the device can do, how do they feel that they could incorporate it into their care plans, which has been wonderful. I get calls and outreach from them all the time for specific clients. We're also reaching out to local hospitals and clinics that if they see someone who could benefit from this. We're working with occupational and physical therapists that we're trying to make people aware. And then, as part of that outreach, the company was successful in getting this approved as a device for Medicare and Medicaid, approved device for the state of Wisconsin. State of Washington has approved it in a little bit broader category than Wisconsin. We're still working on that and advocating for that. But the company has also joined a federal program that is called Access, that talks about reimbursement rates. That's kind of in the early stages, so I can't really speak to how the company is working with that. But it's always been part of our project to try to find sustainable funding or find ways that it can be made affordable. Right now, that monthly fee runs about the cost in our area for 1 hour of in-person in-home care. So it's cost effective, but those costs increase periodically. So we do want to make sure that if we're suggesting things and we're providing things, that people find a way to help it stay affordable for them. I don't know that it's really, second part of the question, I don't know that it's really solving a caregiver shortage. But what I've been noticing in my research, excuse me, is a lot of professionals are advocating for when you're approaching a conversation with, say, an elderly parent or a family member, that you approach it in a spirit of collaboration. And too often, I think we've resorted to, our busy lives have resorted to, did you remember to take your meds today? Did you eat? Did you remember you have a doctor's appointment tomorrow? Don't forget, I'll be picking you up at this time. Well, if those things can be taken care of by the device, so that when you make that phone call at the end of the day, how was your day today? How are you? What did you do? It's not that rapid fire tension of things that need to be done. It's approaching it from a real conversation and a relationship. And I always talk to the people that I'm meeting and say that this allows that opportunity one of the features, I have my son and my daughter set up as caregivers on mine. So if I don't acknowledge taking my medication for several days in a row, they will get a little alert that says, Mom hasn't acknowledged doing this. Now, it doesn't say Mom hasn't taken her medication. I just didn't acknowledge it. But it opens that opportunity for that phone call to say, I had to run to the pharmacy and get refills the other day. Do you need refills coming up? How are your refills doing? As opposed to, why aren't you taking your medication? And I think that's one of the real benefits. It supports that human connection in a way that it's collaborative as opposed to confrontational.
Thank you so much. It's something that I don't think that we've thought about. I haven't heard much about it in the UK, this idea of almost AI on prescription. I think it's such an interesting, really interesting concept. I think you can go to the doctor, and if you're unemployed in the UK, you can get a gym subscription actually. And so this is an extension of that. I feel like this idea of actually it's not always about taking tablets. There are different ways that we can help people. So I really love that. And I also love that idea of actually as we get older, as the people we love become older, sometimes people talk about them being more like children, and you might have to tell the children off and tell them what to do, and removing some of that so you can just maintain that relationship. So yeah, really, I loved the points you made, Mary. Tracy, would you like to add anything?
I definitely echo what Mary is saying. And, to me, Ellie Q would never be able to replace, obviously, Ellie Q can't do physical care, but I feel like in many ways in a caregiving relationship, it can be a pressure release because again, for example, a daughter, if I don't have to have all of those conversations with my mom about, have you taken your meds? What about this? What about that? It allows me to go back to being a daughter, instead of constantly feeling the pressure of the checklist of caregiving tasks that I need to make sure we're taken care of. And so again, I feel like LEQ is never going to take away all the caregiving tasks for folks. I think there's always going to be need for those real human interactions, but at least maybe it is a pressure release. Again, like I said, in that it can allow people to go back to the relationship that they really truly want to have with the person that they're providing care for.
Thank
And
you.
and the person receiving care probably would prefer as well. Again,
Yeah.
my husband, like he mentioned at the beginning, he would absolutely hate it if my sons were calling him and saying, "Dad, did you take your blood pressure medication today?" He would be so irritated. He said, "I'd probably stop answering the phone." So again, if that those sorts of pieces can be taken away and be taken care of through LEQ, I think it can really improve those types of real relationships.
Yeah. Well, I find this whole conversation really, really hopeful. I really do. For the people of Dunn County and beyond, this idea that actually, if we really are intentional in the way that we use AI, we can make a difference for everyone. And actually, this is a huge and growing issue. And if this can provide some relief, some comfort, some insurance, I just think it's really positive. And um, as well as being hopeful, I hope it provides inspiration as well. If anyone's thinking about creating something, look, here is an example of how a whole county has embraced it and is trialing it and seeing how it works. So I hope it provides both of those things. But I hope as well it gives you both validation. Because I can't imagine how much work this has been. You're both coming across so humbly, but I think to advocate for something like this, to try it, to learn as you go, although you're both hugely experienced, but this is new, I imagine there's been a lot of hours, and maybe even sleepless nights that have gone into it. So yeah, thank you both for that. So I want to end. Leah loves a quick fire round. I've got some three short, quick questions for you to just give quick answers to. So Ellie Q in one word. Tracy first.
Potential.
And Mary?
Giggles.
Great. The most unexpected thing a participant has said about her. Again, one word each. I'll go to Mary first this time.
I think that I've gotten some feedback about how she helped them get through some hard times and that it's really grown, and they've made connections with other users during the bingo games or the tours, but they felt that there was that support that they didn't have before.
Oh, lovely. And Tracy?
I would just say the extent that she's improved their lives has been amazing to see and hear.
Wonderful. And final questions. 12 months in, are you more hopeful or more worried about AI in elder care than when you started?
I'm going to say more hopeful for sure.
I'm more hopeful as well. Apprehensive, but much more hopeful.
Oh, that's wonderful to hear. Thank you so much. I'm so pleased that we found Ellie Q and yourselves. I'm so pleased at the work you're doing. And thank you for giving us some time today. And I really hope a lot of people really listen to this episode and get in touch with you as well and shine an even bigger light on what you're doing. Thank you.
Thank you,
Thank
Jenny.
you, Jenny.
Thank you so much for listening to this week's AI for Equity episode. If you enjoyed it, don't forget to pre-order our upcoming book for more. Like, comment, and subscribe. We'll see you next time.